and a very good afternoon to all of those who are watching me live on the Facebook page of News 9. I'm back, and of course, as all of you know, that the COVID-19 situation really hasn't subsided, but we keep on getting updates every single day. There is some or the other update that's also keep on coming from the World Health Organization, and in the latest, the agency has praised the Dharavi model. The World Health Organization, while giving hope to many, has said that the coronavirus pandemic situation can still be brought under control, even though the case numbers have more than doubled in the past 6 weeks. The WHO chief Tedros cited the example of Asia's biggest slum, Dharavi, and said that it has shown that the contagion can be stopped through aggressive action. WHO chief, of course, Tedros, in a virtual press conference said that, and I quote, "In the last 6 weeks, cases have more than doubled. However, there are many examples from around the world that have shown that even if the outbreak is very intense, it can still be brought back under control. And some of these examples are Italy, Spain, South Korea, and even in Dharavi, a densely packed area in the mega city of Mumbai. A strong focus on community engagement and the basics of testing, tracing, isolating, and treating all those who are sick is the key to breaking the chains of transmission and suppressing the virus." So that's what the WHO chief said. The health experts, however, also have claimed that Dharavi, Asia's biggest slum, managed to flatten the curve by the end of June, and it was due to testing, massive screening, identifying patients and their high-risk contacts, and isolating those who tested positive from the community. 9 new COVID-19 cases were reported in Dharavi area of Mumbai on Thursday, taking the total number of cases to 2,347. Do remember, around 80% of the population shares common toilets, 450 community toilets being used every day. It's also being said that more people contracted virus in the community toilets. The cramped locality made it even worse for the people of Dharavi. Home quarantine for the people was just not possible due to lack of space in the slum. COVID, centers created at marriage halls, sports and schools to treat the people who got infected in Dharavi 24/7. Doctors, nurses, medical staff were present. Now, to really speak about, more on the Dharavi model, I have with me Dr. Satish, who's a pulmonologist and joins me live from Vikram Hospital. Very good afternoon to you, Dr. Satish, and I really hope that you're doing well. And thank you so much for taking out some time for us. I understand that you're extremely very busy. So first and foremost, that I would like to ask you, WHO chief Tedros cited the example of Asia's biggest slum, Dharavi, saying that the virus can still be contained. So how did Maharashtra manage to contain the spread, of virus in Asia's biggest slum?
Okay. So, Neha, thanks, and good afternoon, everyone. And it is, such a good news, isn't it? For something like Dharavi, I've been very closely observing. All my friends are there who are working very close to Dharavi, like Sion Hospital, and I get updates from everyone. In fact, Dr. Sunil Kharpade and Dr. Anil, these were, instrumental. There's a physician working there, Dr. Anil, and, many other practitioners, chipped in and then did all this tremendous, work. And as you rightly mentioned in that, the tracing, contact tracing, treating, testing, these 3Ts were used extensively. And when Dr. Sunil Karpade, from the Ministry of Health, also from Maharashtra, took over, known to me through, common friends. And what he did first thing was to take over the complete area and then started testing. And I think in about, if I remember, 8 days or so, they tested about 8,000 or more, people, and then isolated them nicely in various places. As you told me, it's such a crowded, place, and then started treating them and removed, people who had comorbidities. Many were dying. I think it was close to, some 10% or something like that, the case fatality in that area. And we were all worried and looking at, what's going to happen. But all turned after 4 weeks or so. They did a tremendous job. So it shows us the way wherever there is a problem. For example, Similarly, in Maharashtra, my friends may tell me about Jalgaon district. Again, there it's raging just like, Dharavi. Some 2,000 people, tested in that small place, and then some 170 odd patients dying in that area. So again, Dr. Sunil Karpade is gone there to guide and assist. So it is a teamwork. What is required is a teamwork. As you rightly said, first is testing, tracking, and treating these individuals and isolating them from especially elderly and those who have comorbidity. That really help them. Of course, they are doing sanitization. Even now, health workers go door by door and checking on the health, finding out what's happening, and and I believe many were not opening up at Dharavi to the government health workers. So
All
many
right.
doctors and physicians, came in and chipped in and did all this. Wonderful, Neha.
All right.
Wonderful
So,
work.
Dr. Satish, on one side, the WHO seems to be giving hope to many, while on the other hand, the agency says it's very unlikely to be eradicated. My question is that why is there no clarity, given to the public? Is it because of the nature of the virus?
No, there is very clear, lessons and very clear, what is going to happen. This virus is going to stay with us, and it's not, going to go in a hurry. So we are going to see this. We are going to, see increase in some areas and decrease in some areas. This is going to go on till the peaks are gone. Each state will have its own peak. For example, predicted that Karnataka will be, one of my friend epidemiologist and virologist saying maybe September for Karnataka will be peak. Already Delhi is showing decline in number. That is the only state which is showing decline in number. So this will keep happening. So we are not going to eradicate it like how H1N1 which came in 2008. It's
Okay,
not
but
eradicated.
I'm,
It's
I'm
still
sorry to
there
interrupt,
here
but
and there.
what makes the
Yeah.
WHO say that the virus is very unlikely to be eradicated when on one side the agency is saying that the situation can be brought under control? Aren't they contradicting themselves?
No, not really. See, for example, polio is almost eradicated. Smallpox is eradicated. This is a new coronavirus. This is a novel coronavirus. So where there is no immunity to this virus, we are still learning a lot from it, and we know what it does. So eradication is completely different from bringing down the incidence of infections. So which can this is not a deadly virus as it looks. If it was deadly virus like Ebola virus, for example, it would have killed young people. Now 85 to 85% of patients, are mild symptoms, young people, no comorbidities. They are fine to be even treated at home and isolated at home. It's only causing problem to those who are old, those who have comorbidity, which means it's not a deadly virus. So you can control. But remember, Neha, you must keep telling about this three mantras that I always tell. Number one, mask everyone. Mask everyone. If you are just using a mask is useless. Everyone should mask. Number two, social distance, which is not happening. We keep seeing people, talking to each other outside darshanis, very close by. There is no social distancing happening at all. Number three is, hand washing properly. Properly hand washing will help to definitely, control
All
this
right.
virus.
So, doctor, let me ask you this. What's the way
Yes.
forward given those countries which reported zero cases have seen second surge of this pandemic? Where does this vicious cycle of the virus end? Are we seeing it in the near future?
Yeah. So we must be hopeful, number one, and we know by the past, that we can, bring down the infection. And the second wave, third wave, all these are nothing but when you open up. For example, look at Melbourne, you know, and everything was fine, going well, and then they opened up, and now it's a lockdown, 6 weeks lockdown in Melbourne. So these things will keep happening when you open up, and you can't close it forever. How long will you lock down a state or a country for how long? It's not impossible. So you have to open up. So these second waves are nothing but, increase in number as, people open up, go to the shops, go to business, go to the offices, go to college, go to school. This is what is happening, the second wave and whatever. So remember, it can be controlled definitely, but it's not in a hurry, not in, 2 months, 3 months, 4 months, 5 months. Even it may take longer. That's what the WHO is saying.
All right. Coming back to Dharavi, model, of course, doctor, as we have now seen that more or less the cases, the coronavirus spread has been contained in the Asia's biggest slum. So shouldn't it serve as an example? Why not implement the same model in the rest of the states in India?
Absolutely. Absolutely. I agree with you. And it's such a good example. WHO quoting Dharavi. And I've been watching because my friends are there, as I said. Is absolutely. Whatever anybody is doing, we must copy it. Because, the lessons learned from them is so important for us to implement it here. We shouldn't be saying, something. For example, initially, even in Kerala, Kasargod, did that. Of course, now there are problems in Kerala. So these will happen, but we must, take lessons from places like Dharavi and then, check what they are doing and what they're going to, do in the future to prevent another wave or something. I'm sure, the people who live there, know about it. And that is the way to go about it. And as I said, the same Dr. Sunil Karpade has been, now inducted into Jalgaon area in Maharashtra again. So similarly, we have to learn from these lessons, Neha.
So, Dr. Satish, why is it that India is witnessing a steep increase in the number of cases all of a sudden? Initially we were reporting cases in hundreds, let's say now, then later thousands. Now the cases have passed 20,000, 21,000, 24,000. Why is it that India, is witnessing a steep increase, as I mentioned? Was it because we got out of the lockdown pretty soon?
No. I think, every country has gone through this. So look at Spain, for example, UK and US,
But did
every
we learn our
country, and
lessons?
Italy.
As
Yeah.
you rightly
And,
said
and
that
we,
US
yeah,
also is the worst affected country due to COVID-19,
absolutely.
despite having the best healthcare system in the world.
Yeah, yeah. So, Neha, it comes to that, look at just, you gave an example. I'm glad, that you brought this Dharavi into it. What is Dharavi when compared to US? It is the fourth mantra that I already mentioned three: mask, distancing, and also hand washing. The fourth one, which Atul, mentions, the New York famous Indian doctor mentioned about, is the attitude. So the attitude there, about it, and I don't have to tell you about what's happening. People, are refusing masks. One of the famous Brazilian president saying, "I don't want to mask," and exposed recently after he tested positive. The media people who came there. So like this, the attitude is important. So we must inculcate whatever we know. We know about it. If you don't do it, this is going to happen. So why, coming back to your question, why India is noticing, we expected this. We only wanted lockdown to get prepared. That was only to get prepared so that we will not be overwhelmed like what happened in Italy. They were not prepared. Spain, not prepared again. New York, again not prepared. They thought it is some vague virus there, it won't cause problem. So it is only to get prepared. So lockdown, we can't lock down for a long period of time, for various reasons. So what is important for us, why it is increasing? India is a huge country and people move from one place to another.
All right.
You've seen migration and so on, the migrant workers and so on. So we have to educate each and everyone about it, why it is spreading. It is not, a fault of anyone. Huge country, large number of 1.2 billion people, bound to happen.
Right. Right, Dr. Satish, thank you very much for joining us on the Facebook Live of News 9. But for all of those, yes, WHO, the World Health Organization, has said that the situation can still be brought under control. But that doesn't mean that the COVID-19 threat has subsided. Please do not forget to wear masks, maintain social distance, and also keep on frequently washing your hands. If at all you like this video or you found it helpful, do not forget to subscribe News 9 YouTube, like us on News 9 Instagram, Facebook as well as Twitter. This is me, Neha, signing off. Thank you very much for watching.